Good evening, dear friends. Welcome to my channel. So far we have discussed about the deltoid muscle, and today we are going to discuss about the pectoralis major and minor. Yes, before going to explore this video, please subscribe to my channel. Thank you for your support. Let's get started and let's discuss about this pectoralis major. So here you can identify the pectoralis major is arising from the clavicle, sternum, and the abdominal fibers which are arising from external oblique abdominis muscle fibers. Let me explain about the origin of the pectoralis major clearly, which I am going to show you here. The fibers are which are arising from the clavicle, they are arising from anterior surface of medial two-thirds of the clavicle. Then the manubrial fibers which are arising from the manubrium part of the sternum. Then sternocostal fibers which are arising from the lateral border and the anterior surface of the sternum, and also from the upper seven ribs and their costal cartilages, and also the lower fibers which are arising from external oblique abdominis aponeurosis. So here, can you identify the white color sheet is nothing but the aponeurosis of external oblique abdominis. Clavicular fibers, sternocostal fibers, and lower fibers of abdominal muscle fibers. Now, in this dissected specimen, you can identify clearly how these three sets of fibers were divided: clavicular, sternocostal, and abdominal muscle fibers, upper fibers, middle fibers, and the lower fibers. Now, where these fibers are getting inserted, so these fibers, pectoralis muscle fibers, they are going to converge and forms a bilaminar tendon, and it is going to the lateral lip of the intertubercular sulcus or bicipital groove, and it is getting inserted to the humerus. Okay, so the bicipital groove, which you can identify here, is nothing but the bicipital groove or intertubercular sulcus. This bilaminar tendon of the pectoralis major, which is getting inserted to the lateral lip of intertubercular sulcus or the bicipital groove. Now let me explain about this fibers of the pectoralis major. So the upper fibers, which I have told you or explained you earlier, they are going to divide into three different sets of fibers. Upper fibers, they are called as clavicular fibers. Then this red color fibers, which I am going to show you here, is nothing but the manubrial fibers which are arising from the manubrium. And this blue color one, the fibers which I am going to show you here, are they're extending up to the fifth rib. The fibers which are extending from the lateral border and the anterior surface of the sternum up to the fifth rib and its costal cartilages. So these three sets of fibers, they are called as superficial, intermediate, and deep fibers. Superficial, intermediate red, and blue color fibers are called as deep fibers. Then what other fibers which are extending below this fifth rib, below the fifth rib, means fifth, sixth, seventh rib and their costal cartilages, and the rest of the part of the anterior surface of the sternum, and the aponeurosis of external oblique abdominis muscle fibers, they are giving origin to this lower fibers called as lower fibers of pectoralis major. Yes, here you can see that. So from the fifth, sixth rib and abdominal fibers, they are called as lower fibers. The fibers which are extending up to the fifth rib, they are called as lower fibers, deep fibers. Then manubrial fibers are called as intermediate fibers. Clavicular fibers are called as superficial fibers. Now, where these fibers are getting inserted, let us discuss about it. Insertion of the pectoralis major. So insertion is the pectoralis major is getting inserted to the lateral lip of intertubercular sulcus, which I have explained earlier. How it is getting inserted is it is going to form a bilaminar tendon. Bilaminar means two layers of the tendons, and these two layers of the tendons which are going to reach to the lateral lip of intertubercular sulcus. The two lamina, they are called as anterior laminae and the posterior laminae. So the anterior laminae is formed by the superficial, intermediate, and deep fibers of the clavicular, manubrial, and sternocostal fibers. So clavicular fibers, as I told you earlier, Superficial fibers, manubrial fibers are called as intermediate fibers, and sternocostal fibers, which are arising from the up to the fifth rib, they are called as the deep fibers. So these three fibers which are reaching to the lateral lip of intertubercular sulcus, and they are forming the anterior lamina of pectoralis major bilaminar tendon. Then the posterior lamina. What about this posterior lamina is? Posterior lamina is formed by sternocostal fibers which are arising from the fifth rib, then abdominal fibers, the lower fibers. So what is going to happen here is the posterior lamina, which is formed by the abdominal and fifth, sixth, seventh ribs and their costal cartilages, they are forming the posterior laminae, and this posterior laminae which is extending upwards, and it is the at the higher level than the anterior laminae. Let me show you about this two laminae. Yeah, try to see the humerus here. So this is the humerus and this is the bicipital groove, which is the right sided humerus. Here you can identify the lateral lip, and this is the medial lip, and this is the floor of intertubercular sulcus. I'm going to show this particular part which is giving insertion to the pectoralis major. So I have just enlarged it, and I am showing you here these green color fibers are called as clavicular fibers, red color fibers are called as the manubrial, and the blue one is representing the fibers which are arising from the sternum and which are rising up to the fifth rib. Superficial green, intermediate red, and blue color deep fibers. Now these three fibers which are forming the anterior laminae, and it is forming a U. It is just like forming a U shape. This bilaminar tendon, it is almost in the shape of U. So the lateral lip of intertubercular sulcus, which is giving insertion to the pectoralis major, and this two limbs of the U, one is forming the anterior laminae, that is formed by upper fibers, that is clavicular, manubrial, and the sternocostal, and the lower fibers which are arising from the abdominal fibers and also from the below the fifth rib, they are forming this posterior lamina, which I am showing you in this yellow color. Now try to observe here clearly how these superficial fibers are getting inserted to the lateral lip of intertubercular sulcus in the form of anterior laminae, and these three colors which are representing the anterior laminae, and behind that you can identify that this is posterior laminae. Yeah, here you can see that this is the anterior laminae, and this yellow color is representing the posterior laminae. Now what you have to understand here is this posterior laminae, the lower fibers which are twisting and then reaches to the lateral lip of intertubercular sulcus behind the anterior laminae. So this type of twisting of the pectoralis major fibers, which are very helpful in the adduction of the shoulder joint, flexion of the shoulder joint, flexion of the arm or flexion of the shoulder joint, and also medial rotation of the shoulder joint. So that is how these lower fibers are twisting. So upper fibers are becoming lower insertion, lower fibers are extending upwards, and they are getting inserted to that in the form of a posterior laminae, and this is extending upwards. Okay, so try to observe here, this anterior laminae is bit lower, posterior laminae is bit higher in the insertion part. So that is about the origin insertion of the pectoralis major. You can see that the lower fibers which I am exposing here, these are the lower fibers and these are the upper fibers. Vascular supply, the arterial supply of this is by thoracoacromial artery. Strictly speaking, the deltoid clavicular branches and which are rising from the second part of axillary artery, which are supplying to that, even perforating branches of internal thoracic artery, which is present medially, that it is supplying to the medial aspect of pectoralis major. And the superior and the lateral thoracic artery, which are internal branches of the first and second part of axillary artery, they are also supplying to this pectoralis major. So the nerve supply of the pectoralis major is Here in this picture you can identify the medial pectoral nerve. This is medial pectoral nerve which is piercing that. It is supplying to the major and the minor. Lateral pectoral nerve, it is piercing the minor and extends upwards, outwards and supplies to the major. So this is how the lateral pectoral nerve, which it is a branch of lateral cord of brachial plexus, and medial pectoral nerve, which is a branch of medial cord of brachial plexus, those two nerves are supplying to the major and the minor. So here you can see the medial pectoral nerve. Now the actions of the pectoralis major. Actions of the pectoralis major. The clavicular head flexes the arm. Try to see this picture here, GIF image. So you can see the flexion of the arm is carried out by the clavicular fibers. Now sternocostal fibers. Observe this picture here. Sternocostal fibers. They are carried out the movement called as adduction. Adduction and the medial rotation is caused by sternocostal fibers. The abdominal fibers, which are helpful, and it is assisting the latissimus dorsi, in pushing the body upwards when the body is climbing anything. So that is the assisting muscle. Lower fibers are assisting the latissimus dorsi. Okay, that is about the pectoralis major. So clinical aspects of this is the congenital anomaly of pectoralis major. Congenital anomaly is Poland syndrome, that is occasionally part of the pectoralis major, usually the sternocostal part, is absent at birth. So this causes the weakness in the adduction and medial rotation of the arm. So adduction and medial rotation, two movements will be arrested in the Poland syndrome, called as congenital. It is a congenital anomaly of pectoralis major. Then underneath the pectoralis major, we can see the triangular shaped muscle called as pectoralis minor. It is arising from third, fourth, fifth rib, outer surfaces of third, fourth, fifth rib, and the fibers which are extending upwards, and it is reaching to the medial border of the coracoid process and the upper surface of coracoid process, and it is getting inserted over there. So that is about the pectoralis minor. The nerve supply is same like pectoralis major, that is medial pectoral nerve, which is piercing the pectoralis minor and comes outside and supplies to the major and minor. Even the lateral pectoral nerve, which is piercing the upper part of the pectoralis minor and comes outwards and supplies to the major and the minor. This is how it is supplying to the major and minor. Action of this pectoralis minor. Action of the pectoralis minor. So this pectoralis minor, it is an assisting muscle in the protraction of the scapula. So it is assisting to the serratus anterior in the protraction of the scapula. And it is also a muscle called as assisting muscle of respiration. Can you observe the movement here in the respiration, how it is moving upwards and downwards? So it is pulling the third, fourth, fifth ribs upwards. Okay, sometimes this pectoralis minor, it may arise from the second rib, third and the fourth rib outer surfaces. So that is about the pectoralis major and minor. So these two muscles, which pectoralis major also a muscle of the respiration, assisting muscle of respiration. Minor is also assisting muscle of respiration. Thanks for watching, my dear friends. Thank you so much for watching. So with a new video, I'll come to you in the next class. See you soon. Bye bye.